Hello friends, today our topic of discussion is decerebrate rigidity and decorticate rigidity. Coming to what are the synonyms of decerebrate rigidity? It includes abnormal extension or decerebrate rigidity or extensor posturing or decerebrate response. What is the posturing seen in decerebrate rigidity? It includes adduction, internal rotation of shoulder, extension at the elbow with pronation of forearm and flexion of fingers, and lower limbs shows extension, internal rotation at hip and the extension of knee and plantar flexion of foot. Toes are abducted and hyperextended. Coming to the posturing, you can see the upper limbs are adducted and internally rotated with extension of elbow and pronation of forearm and flexion of fingers, and there is extension at knee and plantar flexion of foot. So this is decerebrate posture. Then why the decerebrate posture occurs? Because the from vestibular nucleus there will be vestibulospinal tract. The vestibulospinal tract help in activation of extensor motor neurons in spinal cord and inhibition of flexor motor neurons. So normally this extensor response will be inhibited by higher brain centers at cortex and cerebellum, so preventing this extensor reflex. When this normal inhibitory response from higher center is lost, then the extensor hypotonia will occur because of the vestibulospinal tract, so it causes decerebrate posturing. Then decorticate posturing. What are the synonyms? Decerebrate is extensor posturing. This is flexor, so abnormal flexion. Decorticate rigidity or flexor posturing or decorticate response. This is how the patient will look. We will discuss again. In this abnormal flexion of arms with extension of legs, specifically it involves slow flexion of elbow, wrist, fingers with adduction and internal rotation of shoulder. The lower limb will be same as in decerebrate rigidity, like extension and internal rotation of hip, extension at knee and plantar flexion of feet, and toes adducted and hyperextended. So you can see same like decerebrate, we have adduction and internal rotation of shoulder, but flexion of elbow and flexion at wrist and flexion of fingers. Then extension and plantar flexion as same as in decerebrate rigidity. So why the decorticate posturing occurs? The red nucleus via rubrospinal tract causes flexion and grasping type of reflex of upper limb. As the higher brain centers like cerebral cortex, which inhibits this reflex during normal physiology, with the lesion of the normal corticospinal tract, the red nucleus is disinhibited. So the red nucleus causes the abnormal flexion of upper limb. So cause abnormal flexion of upper limb because of disinhibition. And lower limbs are extended because the vestibulospinal tract is also disinhibited. So this is how these decerebrate and decorticate rigidity occurs. Thank you. Actually, the decerebrate posturing, we know it implies a destructive structural lesion, but it can also occur in reversible metabolic disturbances such as hypoglycemia and hepatic encephalopathy. Thank you.